First, I would like to ask the audience, gibt es Fragen aus Ihrer Reihe? There's one online question. They ask, were the studies done before the pandemic?
Yeah, all the presented trials, open label and double-blind placebo-controlled trials were performed before the pandemic situation. But currently there is an open label trial with the use of immunoglucan during the reconvalescence period after the COVID-19. So we hope that we will finish this trial very soon, and then we will just present the results. But these trials with the children were performed before the pandemic situation.
In case you use immunoglucan as a preventive method, it could happen that during that time even an acute bacterial infection might interfere. Do you then have to stop immunoglucan, or do you just keep on using it?
No, definitely you should continue with all the other natural immunomodulators which are applied in preventive dose. Usually during the acute attack of infections, you can increase the dose of immunoglucan, you can add some other vitamins, minerals, and then after the end of infections, just come back to the standard preventive dose. So without any interruption, and there are no any interaction with antibiotics treatment, which is very important to know.
And about possible side effects?
Well, there is a quite very sophisticated pharmacovigilance for immunoglucan across all the European countries. So there is a regular evaluation of all the possible issues connected with the application of immunoglucan. But any severe side effects we did not observe. There were some small frequencies of some skin rash or of abdominal pain and so on, but no severe some safety data are not presented. Also based not only on the trials, but also on the very effective pharmacovigilance system across the European countries.
Okay, since it is an immunomodulatory, immunostimulatory action, do we have to be afraid of, let's say, somehow challenging an autoimmune disease?
Usually the terminology in the immunology is currently moved from immunostimulation to the immunomodulation, because we do not have any strong, potent immunostimulants. Unfortunately, I would like to have them. So in case of the beta-glucans and some other immunomodulators, we are just saying about the very precise and very mild modulation of immune functions without any risk for overstimulation. Moreover, with this product, we have also some trials with some rheumatic diseases, like Crohn's disease, like rheumatoid arthritis, with very safety profile without any induction of exacerbation of the chronic disease. There is a question that contraindication of immunoglucan. So basically, there are some age limitation, and especially during the first year of life, we are not applying this medicament. And contraindication is unstable autoimmune disease or patients after the transplantation of the organs on combined immunosuppressive therapy, which is quite logical.
In your talk, you did not address other reasons for having recurrent respiratory infections, let's say a primary immunodeficiency or some other pathologically immune system diseases. Is it even possible to use immunoglucan as an adjuvant therapy in children with primary immunodeficiencies?
Well, actually, in primary immunodeficiencies, unfortunately, due to the genetic defects, something is not working in the immune system. So therefore, whatever immunomodulator is not very effective in primary immunodeficiency. But in all these secondary immunodeficiency, which are like 90% of all the immunodeficiency, beta-glucan can be one of the possible additive therapy to the standard management.
Eine Frage gekommen. Ja, how long are you giving immunoglucan without a pause?
It depends on the type of the schema application. There are several possibilities. Majority of the trials were like 3 months of application at the beginning of the season, like we usually starting during the August, September, October, or November, and then you can interrupt. But on the other hand, in certain trials, we just apply the immunoglucan during the whole risky season, like autumn and winter. Currently, there is a preparation of the publication of the trial with asthmatic children, and in this, we use the immunoglucan for 1 year altogether without any warning signs. So it strongly depends on the response of the child. If the child is responding good, you can continue several months. But since this is natural immunomodulator, it's not any risk for that it will cause something unpleasant in these children.